Hello, and thank you for taking the time to watch this video about patient and family-centered care as it relates to physicians and advanced practice providers at Beaumont. While patient and family-centered care is not a new idea, Beaumont wants it to really define our culture. It should be embedded in all we do. The key focus here is partnerships. What do they look like? How are they integrated and demonstrated throughout the system? Patient and family-centered care is about working with patients and families as partners in care, rather than just doing to or for them. Patients define their family and determine the level at which they participate in care and decision-making. It is important to remember that we as clinicians think in a very scientific, problem-solving manner, while patients and families may not understand the workflow or terminology we use. When patients are in the hospital or going through a healthcare crisis, communication often gets lost or misinterpreted. This can lead to misdiagnosis, treatment plans that are not adhered to, and readmissions to the hospital. There are also other barriers between providers and patients. For example, the population of patients we serve is becoming more and more diverse. All of this presents a diverse set of healthcare needs, which requires a better understanding of how to meet our patients and their family where they are. Let's listen to some of our patients and advisors.
I ask a lot of questions and I would want to know my situation in thorough detail. I would expect that the nurses, the doctors would be patient enough to explain everything.
The patient exists typically within the context of a family. No one loves my mom more than me, except maybe my brothers, you know? I mean, no one is more dedicated to her well-being. Nobody knows more, cares more about my daughter than I do.
After listening to our patients and their families, it is clear why this care delivery approach is grounded in 4 core concepts. Patients and families are treated with respect and dignity. Examples can include knock before entering a patient's room, call the patient by their preferred name, shake hands upon entering the room, ask, "Who do I have the pleasure of meeting?" when there is family in the room with the patient. Listen, allow time for the patient and family to tell stories or share information. Sit at the same level of the patient when possible. Apologize for delays without excuses. Always be kind and use empathy in your conversations. Let's listen to a former patient talk about this further.
It's from the person you meet at the door to when they admit you, to the nurses that work on you, to the people that bring you food, to the people that even take care of your room, sweep your room. People may not think about that, but that's very, very important.
Our next core concept is sharing information with patients and their families in ways that are affirming and useful. Some examples include providing timeframes for test results. Family members, as partners in care, are encouraged to share tips and tricks for working with loved ones, food preferences, routines at home, medication sensitivities, typical reactions to pain medications. Be mindful of who should provide test results and who should receive the information. Our patients should always indicate their wishes as to who they want present with them when they receive information. This next core concept really allows the patients and families to be part of the team. They are encouraged to participate in care and decision-making. Not all patients and families will want to participate at the same level. Some may need to be invited and encouraged to participate.
Lots of things about medicine that I don't know. There are lots of things about my family members that nobody else knows but me. And when we take those 2 bodies of knowledge and merge them, you're going to get the best outcome.
Collaboration between patient, family, providers, and healthcare leadership is the perfect partnership to further policy and program development. Now let's look at the many benefits to engaging in partnerships. Patient and family engagement can help improve employee satisfaction with their work. At Bronson Methodist Hospital in Michigan, implementing patient and family-centered care practices decreased the average nurse turnover rate from 21% to 7%. Higher nursing staff retention led to savings of $3 million over 5 years. Engaging patients and families has a positive effect on patient outcomes both physiologically and psychologically. Implementing patient and family engagement strategies on one unit at Georgia Health Sciences Medical Center led to an increase in patient satisfaction scores from the 10th to the 95th percentile. At Anne Arundel Medical Center in Maryland, implementing nurse bedside shift report and communication strategies contributed to significant increases in HCAHPS survey scores. Patient and family engagement contributes to improved quality and safety. When Georgia Health Sciences Medical Center implemented changes to its visitation policy to promote patient and family engagement, the center had a 62% reduction in medication errors, a 40% reduction in falls, and a 50% decrease in the length of stay. CMS has identified patient and family-centered care as one of its 6 goals in its national quality strategy. When physicians engage patients and their families as part of the comprehensive care team, the families act as patient advocates during both inpatient and outpatient encounters. Their participation often provides valuable insights, and barriers to care can be identified and prevented early on. That means treatment plans are reinforced outside of the office through family. Less time is spent on follow-up calls and medication directions. When patients are engaged, costs are reduced due to fewer complications and shorter length of stay, as well as fewer malpractice claims and better patient flow. Now that you know the benefits, you can begin to incorporate some of these tools into your practice. Taking a few seconds to introduce yourself to each person will set the tone that everyone is important to the care of your patient. Patients perceive the time spent by the physician as significantly longer when the physician sits as opposed to stands during a visit. There are initiatives that are being established across the system that involve taking the time to sit with patients and families during times such as consults, providing information and education, and the discharge process for inpatient stays. You may hear of programs such as Commit to Sit and 56-second connection in your area. Take a break from the computer screen and make frequent eye contact with the patient and their family members. They should feel free to ask questions and to provide information which will add to their overall care and how the patient is progressing. Instead of asking, "Do you have any questions?" try restating in another way to be more encouraging, such as, "What questions do you have for me?" Studies show physicians interrupt and redirect the discussion within 12 to 23 seconds after a patient begins the chief complaint. Research has also shown that allowing the patient to speak for approximately 2 minutes at the onset of the patient-physician interaction actually shortens the overall visit, less information is missed, patients are less anxious, and the patient satisfaction increases. Treat patients and families with respect, genuineness, and empathy. Invite patients to share their experience by using questionnaires on an occasional basis to evaluate where improvements may need to be made or adjusted. Patient and family advisors are volunteers who want to improve care and the care experience of Beaumont. Consider reaching out to patients and families to partner to make improvements. For example, in our practices, we are improving signage and registration workflow processes with advisors. Find out more at beaumont.org/PFCC. Remember that care planning should be in partnership with patients and their family. So, what do true partnerships look like? Patients and families are embraced as part of the care team, that we share information they need to make informed decisions about their care. Information about them is accessible to them, and we are including patient and family advisors in everything we do. Beaumont Health is so passionate about patient and family-centered care that we have established a goal to be the national leader by 2022. Ongoing education will be made available. This may include grand rounds, department meetings, and on-site training. Initiatives and programs will be established and available to improve practices that will reflect in outcome metrics, such as Press-Ganey scores, readmissions, and medication adherence. We encourage you to consider participating in research and to design opportunities for research. Resources are available to assist in this journey. And, as mentioned, additional training will be available to expand skills and learning opportunities. We encourage you to have conversations with patients and family members who want to improve care. Ask them to consider being an advisor. You can direct them to our PFCC page on the Beaumont website. If you have questions, we have a dedicated PFCC team, including site coordinators who are local leaders in PFCC. You don't have to wait to start changing practices. Think about one small change you can make tomorrow and start there. And thank you for your commitment to provide compassionate, extraordinary care every day.